Time being 6 o'clock, I'm going to call the Board of Health meeting to order. All members are present with the exception of Katie Van Ness. Would everyone please stand and join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated. First item on our agenda are public announcements, specifically announcements from the Health Department. This time I'll turn it over to our Health Department staff to provide us with those announcements.
All right, just have two today. First, I should mention that we have had complaints / reports of increased rat activity in town. There's been some street construction, which tends to scare them up. What we did this time around was do a targeted mailing to the neighborhoods that have complained with information on how to keep rats out of your yard or minimize them. So just would ask residents if they see rat activity to let us know, and we can send out more mailings. Unfortunately, they are native to the area. They're here. Whitman, Rockland, surrounding towns are all struggling with them, so that's that. Second, I would like to say the Health Department is starting an initiative with trash for our residents who are using municipal trash and recycling. With the rising costs of trash and recycling, the Health Department is announcing a townwide initiative to enhance compliance with our trash and recycling regulations. Over the next 6 months, the Health Department will be conducting random spot checks to ensure that all residents adhere to the established guidelines. Your cooperation as a town in maintaining proper waste management practice is crucial for our community's cleanliness, environmental sustainability, and the fiscal sustainability of our current trash management practices. By all of us following these guidelines, we help preserve our environment and ensure that our waste management system remains efficient and cost-effective. We will have information on this posted on our social medias, and again, if anybody has a question, please call the Health Department. And I think that's it for updates.
Okay. Any questions for the Health Department? All right. Seeing none, we will roll right into our agenda. A little bit before this, we can take it on now. We have a public appointment with a request for a HACCP plan approval from Terranos Market. We have representatives. Want to come up to the podium and just state your name?
Hi, I'm representing Terranos Center Market. We're planning on do the HACCP plan to do vacuum pack meats for the deli.
Okay. Do you have anything available for us this evening at all, or?
No, I'm waiting on permission from town because we have to provide labels and everything, and that's a big pack to print and investment.
Okay.
And we're waiting on approval before. But it's got to be a plan with all the requirements on dates and ingredients, name, all the requirements for the mix.
Chris, can you speak to the specific code as to what's needed for us to make that approval?
Yeah, so do you have a copy of the HACCP plan?
Yes, we do.
Okay.
Yes, we do, and we
And
also
the way-
email it to the town. I think it's on Board of Health.
Yeah, I will submit to the health department, the HACCP plan, and then also the template of the labels with the instruction and the cooking time and all this stuff.
Okay. I mean, if you have a copy of the, extra copy of the plan here, if you want to leave it
I
tonight,
do,
we
yeah.
can, we can review it and save you
Yep.
some time. Awesome. Right.
Okay.
Yeah, oh, you'll hear, yeah.
It's a big package.
Oops.
All right. So we now have a copy of the plan, which has been submitted to the Health Department. Does the board have any specific questions for Terranosa before that gets reviewed
No,
prior to that?
I love seeing you guys expand. We're really excited.
Thank you.
So, who wrote up the plan? Did you guys write it up? Did you hire somebody to write it up?
I developed the plan. My name is Sergio, I'm a serve safe instructor, and because we speak Portuguese, I help her to develop the HACCP plan. I have been done this before for other cities, I have experience.
I think, don't we as a town have somebody that also looks at HACCP plans?
I submit to the city.
I mean, so that we can take yours and, you know, have it
I don't know,
verified with somebody
Board of
else?
Health doesn't know a lot about this plan, to be honest.
Well, I mean, we are the Board of Health, so.
Yeah, so it's something
Yeah.
different. I don't know what to say, because it's new to me too.
So I'm also a Serve Safe instructor, not in Portuguese or, but I wouldn't be qualified to write up a HACCP plan.
Yeah.
No.
Yeah, so the HACCP plan have a template for specific HACCP for the vacuum packet. So, but of course, it's different situation. I have to do a lot of modification on the template, so it's easy for the developer. But so I submit to the health department like a month ago, and I'm pretty sure they already check it. But if you have any question, you can ask us.
Well, I'm sure that the board has under its umbrella the
Yeah.
potential to counter your HACCP plan with some, I don't know, substantiating.
Well, I think the big thing is by having you write the HACCP plan, you need to be the ones to enforce those controls for those different critical points. So we want you to write that and understand where those critical points may be and how to mitigate them, more so than us providing them with something. And I think
Yeah.
that's the value in that.
Yeah, I will be training all the employees involved on. That's why I'm gonna be the one who's training them to make sure we have, on the labels, the product ingredients, date, because it's specific validation, and temperature on the meat. So I'm gonna be the one training them.
So, and it's reduced oxygen packaging?
Yes.
Specifically?
Yeah,
A 30-day validation packages.
because when you have a vacuum packet called ROP, reduced oxygen
Yeah.
pocket, right? When you reduce the amount of the oxygen inside the pocket, you will be able to keep under the fridge for 30 days.
Sure, and like a package of bacon is in reduced oxygen packaging, just so that,
Yeah.
so.
Yes, but have to be careful to do the
Right.
correct weight, because if you don't do the correct weight, it can develop like a botulism or another bacteria.
Well, just a
Yeah.
pinhole will introduce oxygen.
Can be, yep,
Which makes it all move.
yes.
Yeah, so interesting.
Yeah. When we start with 5 products and each label have a different ingredient, but everything on the hazard plan. So, and she gonna use 2 different labels. One label describe the products and the ingredients, and another one the expiration date.
Are you gonna have to apply for a state license for this?
No state
Oh,
license. We
okay.
don't need.
And I'm gonna have both languages on a pack, Portuguese and English.
Oh, that's excellent. Yeah.
Yep. We're excited.
No, yeah, I'm just curious, yeah.
Any other questions from the board? All right, you may be seated. Thank you.
Thank you.
Thank you, appreciate it.
So as far as moving forward with this, I would like to make a motion that we allow the health department to review this HACCP plan, and if found to be in order, they can issue the variance, it's not a variance, the approval to move forward with that. So that's my motion.
Seconded.
Second from Manny. Any further discussion? All in favor?
Aye.
Opposed? Okay, so you folks could
We
review
get
that.
some homework.
Let them know that that's all set. That'd be
Thank
great.
you, and I'll be in touch with you.
Thank you.
Okay. That completed, we're going to move around some of the discussion items this evening just because of some scheduling things. So I'm going to move up item number 3 to the top, which is our COVID-19 update. I'm going to turn it over to our public health nurse, Lindsay Wright.
All right, well, thank you for inviting me tonight. One of our great board members asked for some updated information. And so I am here tonight to give some updates and talk about testing and a couple other things. So first, the health department has some free COVID test kits available in the health department. ASPR, which is the Administration for Strategic Preparedness and Response, made available to jurisdictions test kits. So we ordered some and they have arrived. So residents can come down to the health department and we are going to bring some to the senior center to make those available across town. And then a question that comes up often is using antigen kits past their expiration date. So for a long time, the FDA was approving kits to be used past their expiration date. I will put on our social media as well as our website, and I will leave packets of this information down on the table out in front of the health department. A link to check different brands of test kits. There has not been an extension of test kits recently. The last one I believe was in 2022. There was found to be a lot of both false positives and false negatives, with extending beyond the initial extension date. So that practice has gone by the wayside. So if you have any expired tests, just get rid of them. They're no good. You will get false readings, or the potential for false readings. And so there are two types of tests. If everyone remembers back to the throes of COVID, two tests that we can detect the virus with. It's a PCR test. That is the polymerase chain reaction test that works by amplifying the DNA. And that takes anywhere from 1 to 3 days typically. We do have the ability to do it in about an hour. It's relatively inexpensive, but that looks at the DNA fingerprint of the virus. So it's actually looking at the makeup of the virus, and it can identify the exact strain. That is only collected by a healthcare professional. It's sent in a lab setting. And then the antigen tests are what we have at home. They're the rapid tests that we think of. They are not as sensitive, and they're less likely to detect the virus if symptoms are not present, because they work off of the proteins that are present in the antigens rather, when you are actively infected. Samples are typically self-collected. Results happen in 15 to 30 minutes. And those are, again, are not always the most accurate if you're not symptomatic. A PCR test can remain positive for 90 days from your initial infection. So if you can get sick again within those 90 days. You can be exposed to a different strain. So within those 90 days, it's not recommended to get an additional PCR test. So if there's a breakdown of who should test and when they should test and how they should test, give me a call. I'll walk you through it. I'm 4 years into this and there's still days I'm like, wait. So just give me a call and we'll walk you through it. Also, Mass.gov has great guidelines on if you have symptoms of a respiratory virus, what are you supposed to do? How are we treating this? You know, it's not this, you're home for 5 days or home for 10 days. If you're exposed, what you're gonna do. I won't go step by step through it. It's, 2.5 pages, 3 pages long. But all of this will get posted. It is already online, but it will get posted again, just because we are seeing an uptick in the number of cases. We don't track cases the way we were tracking in the height of COVID. We are not investigating cases and clusters and all of that the way we were. It is very resource intensive to do that, and we know that as people are getting ill, they're getting ill with multiple things, not just COVID. And so the biggest thing that we ask is if you're not feeling well, stay home, wash your hands, and if you were with a bunch of people, just say, hey, I was sick. I don't know what I have, but I was sick. What we do know for sure is with cases increasing, we're seeing a significant rise in wastewater sampling. And so reportable cases through DPH and what gets reported back to the jurisdictions don't always align with wastewater, because antigen testing doesn't get reported back through labs. They're done at home. So a home test doesn't get called back in. If schools are testing, if college kids are testing, those tests can sometimes fall by the wayside because they're not captured. PCR tests are reported to the state, but not everyone tests through a PCR. And not every physician is testing. If you check off the box, then if you're clinically positive, there is a clinical positive for COVID now. So they might not waste the time of testing. That is my spiel about COVID and testing and what to do. Stay home if you're sick, wash your hands, and we will be doing flu shots this fall. I did order some COVID-19 vaccine if anyone is interested. We will have both pediatric and adult COVID and flu vaccine in the health department. And appointments will be made available as soon as we get the vaccine in. And I am done.
Thank you.
Unless Anybody has any questions? Hearing the thank yous, I assume we're good, right? We'll move on. Again, out of order a little bit, we're actually going to move to item number 2, because I know we have some guests that are planning to speak with us this evening. So this is the discussion regarding a pre-rental housing inspection regulation. I think just want to jump right into if anybody wants to make any comments or things this evening on that. I know we invited our fire chief as well as others, so unless anyone's hankering to start first, take in any order you'd like.
All right, thanks folks for coming in. Building Commissioner Bartley Kelly and our Fire Chief, Jack Lynn. It's a continuation of discussion we've had several times here in the board regarding annual rental inspections due to the conditions that have been in this community and continue to get worse. So you've heard from the trifecta. I happen to be the Building Commissioner, a resident, and a member of the board here. So you've heard my concerns, and I thought it'd be a great idea to bring a fellow colleague in who is from a mutual, a neighboring community who has this process in place, and maybe he could speak a little bit about why it was implemented, how it's going, what their process is like, what their regs are like, and some of the pluses and minuses for that. And then also our fire chief here, who is side by side in the front lines to see, talk a little bit about what he and his men and women are facing out there, just to get a little bit more grasp to further the conversation. So if any, that'd be great.
How you doing? I'm Bartley Kelly, I'm the building commissioner.
Just come here so they can hear you at home too.
My name is Bartley Kelly, I'm the building commissioner of the town hall, and I also do the Board of Health rental inspections in the town. Town Hall implemented a policy back in 1969. It was a lot of summer cottages where they did rental inspections, and when they put the legislation in place, the town bylaw, it was required to be done once a year. And most of them were done for the summer rentals. Over the years, it transferred. There's probably 5,500 homes in Hull, residences. Right now, about 1,400 of them are rental properties. And so the law's been on the books since 1969. It was sporadically enforced until about 2008 after a fatal fire in Quincy. The town manager said, listen, this bylaw's on the books and we're going to enforce it. If the town wants to change it, they can go back to town meeting and change it. And when we first started implementing it, a lot of the landlords were against it. They're like, oh, this is another tax, it's a pain in the neck. There's a lot of, and as it's got going, we're doing the rental inspections, you find a lot of things that are wrong. You check and it's a safety inspection, but it's the housing inspection according to 410 CMR, 105 410 CMR, the Board of Health. And so it's fitness for human habitation. But you're looking at smoke detectors, carbon monoxide detectors, egress, decks, landings, heating systems. And so you're going through the whole house, you're checking the plugs, the GFIs. It's a pretty comprehensive inspection. And as you're doing it, the more you're doing it, the better the housing stock gets. And the landlords learned in the long run that it actually worked for them as well. Because now they're getting a rental inspection that's showing that their house has been inspected and there's nothing broken. And so now if they have a problem tenant and they end up going to court with a problem tenant, they can pull out their inspection sheet and it says, hey, this was inspected this year, last year, and the year before, and all of a sudden the doors are broken, windows are broken, this is broken. It works for them. But it keeps the landlords in check as well, because if they're not maintaining their property, we're seeing it. And it's got to the point now where I'm doing an inspection, I did one Friday, and I'm doing decks and railings. I'm like, the railings are loose, this is loose. I go, you got to tighten all this stuff up. I said, but realistically, I go, you probably got 2 years left out of this whole thing. You should be replacing the whole thing. But if you want to fix it, you got to fix this, this, and this. But put it on your radar, because that's going to be a capital expense. It's going to cost you some money. You know what's coming down the pike. You got to do it. And so it works both ways, and it's very effective. It's helped with the safety, and it cuts off a lot of problems in the past. Because, I mean, you go into cellars, you're looking at somebody's heating system, the venting's not right, it's pulled out of the chimney, now you got a heating system that's venting into the cellar, it's putting off carbon monoxide gas. That puts people to sleep, and it's the eternal dirt nap. It's not good. So, I mean, I think it's a good program. I think it works well. A lot of other towns are considering it. I know the town of Cohasset is going through, you folks are going right now, they're looking at it as well. And, I can't say enough about the program. It's done very well for the town of Hull. So I encourage you to think about it and, make a decision that's best for your residents. Thank you. If you got any questions, I'm happy to answer them.
No, I mean, is there any negative effects that you've seen with the process?
No, I don't see any negatives with it. I mean, it's something that the inspectors can be trained in it. The Board of Health inspectors, there's housing inspection classes. It incorporates the plumbing code, the electrical code, the building code, all are incorporated into 105, Chapter 410. So it's an inspection process. I ended up doing it because they needed another inspector. I'm the building commissioner, and I do inspections anyway, so it worked out well. And now I'm doing the lion's share of them because, you know, they don't have enough inspectors, and I got a pretty good rapport with most of the landlords, and I know my way around the town. But it's something that, you know, you can train your inspectors for. It's a good program. I can't say enough about it.
Great. Thank you so much.
Thank you.
Jack Lynn, I'm the Abington Fire Chief. Thanks for the invite. I was speaking with Jason about this for a while, and he was kind of throwing the idea out at me based on what we're seeing out there. And what we've seen is most of the time when we see these apartments or, you know, the rental properties, it's when we're there for a medical call. We don't have access to get into these buildings. It's not like with a common vic license or a commercial garage license or something like that, where annually we get in there and we can actually see and go through the safety stuff. For us, it's someone calls us for a medical emergency. While we're in there, we notice, you know, there's a wall there that there's no smoke detectors, smell of gas, you know, unhealthy situation, unsafe situation. And I'd say it's a combination between COVID, when everything got shut down, and Jason coming on as the building commissioner and being so much more proactive. We're seeing a ton of them now, and it's almost, no exaggeration, it's probably a weekly thing. We get together, we end up coming across a building, and next thing you know, my fire prevention captain's there. Jason's coming out, the wiring inspector's coming out, Chris is coming out, and we're seeing this on a regular basis. And it's a safety thing because we need to protect these people. And a lot of them, they're terrified of, you know, gosh, you know, this is all I can afford here. I don't want to get the landlord in trouble. I don't want to do this or anything else like along those lines. So they're concerned for themselves. But at the same time, they're willing to put up with a lot of risks. We don't see it until we get in there. Once we get in there, then we can act. So sometimes, you know, we may not be in a building for 8 or 9 years and not see it. But what Bart said, I think, is a terrific thing, that over time, if the landlords are going to buy into it, that they're going to advertise that, hey, we've got the safest buildings around. You know, we're doing this, doing that, or whatever. I talked with my fire prevention captain, who's on vacation this week. He's totally in favor of it as well, too, from what we see. We're definitely seeing an increase on this. And anything we can do to make it safer, because that's the ultimate thing. Like, we have some of the big, newer apartment buildings is one thing, but the houses, the old Victorians that are 100 years old that are cut up into 6 apartments that we may have not been able to get into for a long time, those are the scary ones, and we don't know, and we're not familiar. The stairwells that are 2 feet wide, you know, things like that. So we'd love to see something like that happen. I think it can only be a positive all the way around for us. So. Any questions or?
Thank you, Chief.
Yeah.
Okay,
That's it.
all right. So,
So we're looking to make, I've missed most of the
That's
summer.
okay.
So I don't know how that happened, but I wasn't even doing anything fun. But so the request has been to re-up a regulation that's already been on the books, it
create
sounds
a
like?
regulation that doesn't exist.
Okay, so it doesn't exist,
Right.
even though it's something okay.
Correct.
Got it.
Well, it's not necessarily something we're supposed to do, but as we've heard, I
Yeah,
think
it
it's
definitely is
something we
needed.
probably should
Yeah.
do. This was brought up 2 years ago, and the Board of Health shot it down at the time, because we didn't have a good plan for enforcement, and that structure is starting to come around.
Yeah.
So that opportunity, now that it's presented itself, is why it's back.
Perfect. Love it.
So, we need a piece of paper with a regulation on it. I think that's where, yeah,
Sorry to interrupt.
yes.
I actually brought a copy of the town halls.
Oh, is that a copy that we could steal from you?
Them all.
So, there we go.
I brought
So,
copies of the regulation, I brought copies of the checklist
that's
for
wonderful.
the inspection.
Thank you.
The inspection sheets. There's
Perfect.
enough for all these, I think.
Okay.
Oh my
perfect.
gosh, thank you. Thank you.
Take some down, pass it around. So pretty much, this might be a good place to start, right? Okay, there we go. So that we can get an idea of what this is going to look like for us.
Thank you. And I think at this point, we've heard it from our chief, we've heard it from a mutual neighboring community, and I've talked to several other colleagues that are, starting the same process. You know, and a bit of it that's pushing it forward is you have some of the new language in the new adopted building code that's coming out too, as we spoke about before, that's kind of pushing it in that direction anyways.
Yep.
But like you said, looking at it through the lens of the Board of Health would be the healthiest way to do it and most proactive way to do it.
Well, and I think more what I'm getting at now is, you know, in order for us to do this, we need to draft it. We need to look at it, we need to deliberate on it and move forward with it.
Yeah.
I don't see any reason why we couldn't do this expeditiously if we have the resources in place to make it happen. Especially if we use an existing,
Massachusetts, yeah.
regulation.
Agreed.
So, I guess the next thing I want to see happen is maybe we just take this, throw Abington into it, see how it looks, see how it feels, and we go from there.
Great.
I like that. How many rental properties do we have in Abington? Do you know off the top of your head?
We're kind of working on that right now. You know, we have a little bit of help at the assessor's office trying to,
Yeah.
between my standard inspection routes, you know, I've split the town up into quadrants, so I'm trying to keep a good track of it, beginnings of it, and then getting a little bit of help from the assessors. But over this next week or so, we should have pretty close to what we
Okay.
have. So by the next meeting, I should have a
Yeah.
ballpark number.
Okay, cool. And
Where we're at.
yeah, and I know that Massachusetts just changed, you know, ADUs are allowed, so this is something to get ahead of it, where there might be some changes of what,
My exact point.
Yeah,
And I
so
brought
this
that up
is-
at the beginning, you know, let's be proactive,
Yeah.
because one, and we're at some point, we're gonna be forced to do it. I think that it's best if we discuss and make a decision together as a board to do it the right way, instead of doing it and being reactionary.
I was about to say, let's have an incident and then we do something. Yeah,
Correct.
100%.
But we're seeing so many incidents now
Yeah.
that,
It needs to be
you know.
done. Great. This is really helpful. Thank you for bringing the people.
Thank you. It saves us from having to go search and figure out, pick and choose what we want to do. And this is actually a lot shorter than some of the ones I've seen, so.
Awesome.
All right, so let's plan to do that then. I'll work with you folks. We'll type something up and then go from there. Maybe if we can get some eyes on it from council ahead of time, that would be helpful as well. Any further discussion on that? No? Perfect. All right, then we will move on. All right, we are going to sneak back up to item number 1, which is the review the draft regulations of animal regulations as amended by town council. So
thank you, fellas.
these regulations have been like dissected and moved around by them with no explanation as to why.
Of course.
So, case in point, we are now being asked to hold a public hearing on this with every single permit applicant.
I saw that.
Which is
Yeah.
not what we set out to do. There are, permits are now expected to expire on June 30th. That's off of every other permit that we have in town. There's typos in here. It's a mess. So,
I feel like this got bigger.
it's got slightly bigger. And this is part of my ongoing frustration with this review process is we go with something that we're kind of okay with and then it gets changed with no rationale as to why it was changed this way. So I know, first and foremost, we are, and Chris, you can take an opportunity to chat your concerns on this, want to go to town council and ask specifically about a few certain things, such as why is there a public hearing added into here, right? Was that a statutory requirement that we didn't know about? Why can't you cite that? I want those answers, and I can't seem to get them. Chris, you want to comment? Because you have highlights and I don't.
Yeah, so I kind of ran through this. So just running down from the beginning, section 4C, as Aaron alluded to, permits shall expire on June 30th. That's fiscal year. All our permits, with the exception of funeral directors, expire December 31st. So I don't know why you would want to do this mid-year. There's really no reason for it. Other towns that I looked at, theirs expire annually, end of calendar year.
I mean, that keeps, the December 31st keeps aligned with the pet stuff too, where you have to, return your town census and you have until May, so.
Yeah. Under
Dog
section
licensing, not pet licensing.
4.3, public hearing. Again, so this process for basically anybody that wants to have 6 chickens in their backyard is gonna have to go to the assessor's office. get a list of all their abutters, send certified letters to all their abutters, get those, then appear before the board and have a public hearing, where they've already submitted all the information that in everywhere else in these regulations can be reviewed by the agent of the board, and it's an administrative decision. If somebody was looking for something unusual or a variance, certainly a public hearing is warranted. But if it's just,
Do they think that this was the stable kind, like they're treating it as the stable regulations, which is bigger, which we were thinking more animal, and then we would do the stable separate?
I mean, considering the word foul is used in here.
I know, but it seems like it just got bumped.
Yeah, stables are included under, in section 5.
Yeah,
And,
but
well,
it just,
and specifically, you know, I just want to know why half the time these things get added. If there's a reason this needs to be here, I just want to know where it is so that we can do the right thing.
okay, yeah, if they can provide like a
right.
change, like track changes.
Exactly, well, and that's, the document was a track changes document with no comments made. So that's the thing that drives me absolutely crazy, is that at least we know what was changed, but we don't know why it was changed.
Okay.
So pardon my loudness, but
Sorry.
this is the third time this has happened on a different regulation. So, I'm sorry, did I cut you off, Chris?
Nope. And I think it's good for the board to discuss, as far as having a public hearing and notifying abutters. I mean, I don't know, I think, Amanda, you have chickens. If you were,
19?
if somebody was your neighbor and didn't know, like, maybe they want to know, but should the board be requiring them to be
No.
notified?
No, and particularly because we don't have we're not looking to add regulations, we're not looking to add work for anybody involved. We're doing it for, at the end of the day, the safety and well-being of everyone in town, both the animals and the people. And to help our animal control officer have this understanding, and so making it this elaborate, this is why people didn't want this, because we just made it really too government-y.
Yeah.
Is that a term?
Yeah, I guess,
So, yeah, I look back at some of our, and it's just, there's a lot.
I don't think this needs to be regulated to death as it is. I mean, we were looking for a very clear administrative process just to keep a record of what kind of animals we have in town and where.
Right.
And this is turning into, it's like project creep. The thing just keeps getting bigger.
If I got 6 chickens and I saw this, I'd be like, I'm not doing it, so you can come after me.
yeah.
Yeah, and not to mention now that, you know, there's this sample acreage thing on the back, which is, again, not even close to what we were looking for. You mentioned, Chris, about certain things need to be 25 feet away. You didn't mention exactly what it was. I don't remember what you were saying.
Yeah, there may be some zoning laws, and I believe it says in the regulations that if somebody satisfies the Board of Health regulation, that does not supersede building or zoning.
And
That's fine.
building and zoning is like, for example, my chicken run, because it is just hardware cloth, can be as big as I want it to be and as close to the property line, but the coop
Has to be
under
maintained.
10 by 10, which is huge, mine also could be against property line, but we chose to bump it, you don't want it right on your property line anyways, because then you're just gonna, but the zoning covers larger structures already, so very few people would even be affected by that, or have to, they just need to be aware of it, but this is something that I feel like Braintree does, like this setback
this
with the,
Probably came from somewhere.
yeah.
So, I mean, I guess,
'Cause I'm already at fault for the setback. And
Well, and that was my other thought. So I
Acre
know we have
single.
quite a few houses that have animals already.
Yeah.
This does allow for people that already have them to just apply for the permit. They wouldn't have to go through a public hearing and all that. But setbacks, unless we're grandfathering half the town, you know, a lot of people already have existing structures, and we're certainly not going to tell them to move them unless they're in violation of, you know,
Yeah.
other already standing rules. So, yeah, it just seems a lot more beyond, but from the health department point of view, and as Aaron mentioned, really the thing that we just want to know how many animals are in town, where they are. If there's an outbreak of avian flu, I need to be able to go down the list and call everybody that's got birds and say, you know, hey, you need to quarantine.
Point of contact information.
Yep. If there's an emergency and we need to evacuate the town,
It's the
what are we
same
gonna do with
reason you
these
have
animals?
the dogs, and then if you have more than 4 dogs, it's a kennel, like it's,
Right.
Yeah.
you
What do you
know.
have and how to get hold of you?
Yeah.
You know?
Having read these regulations, I think if the board just redline some of the items that have been added, they're probably fine as they are. I also did find, like, Pembroke has their regulations are in a guidebook that they sent out. I can send copies to everybody afterwards. I just
Oh,
didn't
yeah.
want you to have to start all over from, square one, but.
Well, I think the first step I want to do, though, is go to town council and ask why certain things were
Sure,
added.
yeah,
I
is
wanna
there
get those
something that we
answers.
missed, like you're saying, like state
Right.
or requirements we weren't aware of?
And the reason I didn't do that ahead of time is I wanted to ask you folks, if there's specific things in here, can you let me know via email in the next day or two so that we can just get
Yeah.
something over to them?
Sure.
Perfect.
Anything that's red line is probably gonna get asked, but if there's something in particular that you catches your eye, you wanted to have a question about, I wanna make sure those are all included in one
No,
message.
I think what you brought up is what I caught my eye the other day, so.
Right,
And then definitely the abutters and, no.
yeah, and I think specifically section 4 is the thing that has grown, because I think we
Yeah.
only had up till D, and I think things got added in the middle there, and that's why it's grown.
Yeah,
I suppose if somebody's looking to build a stable,
that's what I'm saying.
maybe
like,
that's, but
But
versus
there's
a,
certain-
Sized or something like that.
Yeah.
That's
It's
a special
reasonable.
circumstance, like you were saying, but.
yeah.
Okay, so I think we'll start there, we'll get the answer. I'm pressing on this mostly because we did go to town meeting and ask them for stable fee to be put in place, and I don't think it's fair to have that get put in and ask the town to vote on it and not have something available
Yeah.
in some reasonable amount of time. So I'm gonna push forward with that if it's all right with the will of the board. But
Yes.
we'll get an answer on that, and we'll be able to hopefully move forward
Great.
and get this thing done. Any further discussion on that, questions? No? Okay. None of the fun stuff. Vote to approve the minutes of July 15th, 2024. Everyone should have a copy of those. I will take a motion from anybody but
Make a
Amanda.
motion to approve the minutes?
I just noticed my name was misspelled.
Okay, well, so we have a motion from Jason to approve, but we don't have a second yet. So I'm going to actually make a motion to approve the minutes with the amendment of correcting Susan's name. Do I have a second? No?
Perfect.
Okay.
Why
I will
don't you-
second.
Yep.
There we go, perfect. Any further
I didn't
discussion?
think I could second
I
it
don't
because it was
wanna- I
about
don't
my
wanna
name.
hog all the
my
fun.
No, that's fine.
Very good.
Any further discussion? All in favor? Aye.
Aye.
Abstain.
Opposed?
Yep.
Okay.
I was not here.
Well, there's, yeah, no, okay, that counts. Perfect, those are approved. Can you just fix that in the Word document? I'll
Yeah.
copy. Actually, I will. I'll do that.
Did you sneeze really loudly?
Okay. Health agent report. Health
right.
agent report.
So I haven't given one of these in a while.
Welcome back.
Welcome back. We had a few more inspections that are listed here since the last board meeting, but I didn't want to give you like a 3-page thing, so I put August down. We had one re-inspection, which was Spencer's Pizza. They corrected everything from the prior inspection. The Cellar, Lynch's Tavern, Mary Lou's on Center Ave, Strawberry Valley Golf Course, Center Ave Sunoco, First Baptist Church, Ellie Street's Smith Superstore, Smart Stop Convenience, and the UCC were all inspected and passed. We had no priority violations this month, which is always good. As far as complaints, we did receive a complaint about underage teens buying vapes at 7-Eleven on Brockton Ave. Upon an investigation, it's adults buying the vapes and then selling them to the kids out front. That's terrible, we don't like that, but there's nothing we can enforce because the store is very strict on selling only to 21 above. In fact, I got a report from the DOR, which had been out doing stings in the last few months, and no Abington stores were cited.
Oh, cool.
I did send an email to the owner of the 7-Eleven just to make them aware of the situation, because the person that made the complaint noted that it was happening in front of the store. But again, from a health department point of view, there's no enforcement. We received a housing inspection complaint, rodents in the wall. We went out and did a housing inspection, working with the landlord and the tenant to resolve that situation. And as I mentioned earlier, we've gotten complaints of increased rack activity. We sent a mailer out to West Chapel Street, Everett Street, Orange Street, and parts of Washington. That's one neighborhood where there was some road construction going on, so there's been a bunch of sightings. Part of my PT after surgery has been walking my block, and I've noticed rat activities in my neighbors' yards and my own, so I sent a mailer out to Niles Street as well. And then finally, training or conferences attended on August 1st and 2nd. I attended the social media engagement strategies training. It was a FEMA course, just on social media. We're trying to better utilize the tools that we have at our disposal. And that's it for health agent report.
Any questions?
Chris, did the whole office take that training?
Yes, it did.
Oh,
Yes,
great.
yeah, we all took it.
And aren't the Sunoco and the Mary Lou's in the same building? They had different inspection dates?
Yes, they did.
Okay.
Yeah.
Just asking. All right. Seeing no other questions. Public comment? Public, do you need to comment? Perfect. Yeah. It was like packed when we started and,
I know.
that's. All right. Correspondence. Does the board and/or health department have any correspondence to share?
Nope.
I will share that we last Saturday, not this past Saturday, but the Saturday before, I volunteered at the compost site to have the swap shop open for Saturday. We got a lot of foot traffic. We're working on the swap concept. People are great bringing stuff, not so much taking stuff. So it's kind of busting at the seams. I would really, really like to see our swap shop open on a regular basis. However, we weren't not allowed to hire anybody because it just wasn't in the budget for the town this year. And we already have a shortage of volunteers for the compost site. So if anybody in town is interested in volunteering, either during weekdays or on Saturdays at the swap shop, that would be awesome. It would be great to have it open. We're just not able to man it on a regular basis right now, so. That's it for correspondence.
Okay. Just want to mention one more thing. As a reminder, we go back to 2 meetings a month starting in September. September, Labor Day is the first Monday of the month, so we will meet on September 9th. And it'll be a double whammy because we meet again on the 16th, so it's 2 weeks in a row, and then we go back to our normal cadence after that. So
Okay.
just mark that on your calendars appropriately, and for those of you that enjoy watching your Tuesday morning Board of Health meetings on YouTube. All right, and with that, that is the end of our agenda, and I would entertain a motion to adjourn.
I'll make a motion to adjourn.
Motion to adjourn by Susan, do I have a second?
I'll second.
Second by Jason, all in favor?
Aye.
Opposed? We are adjourned.